Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through March 3rd, 2022. Today, I'm going to address two questions, the same one we've been asking every week, which is how is the pandemic progressing? And this week, I'll address the question that has come in, which is what is this new mask guidance from the CDC? In terms of the pandemic progressing, we are continuing to see a reduction in the most recent Omicron spike, though I will point out that daily cases around the world are still much, much higher than they have been at any other time in the pandemic. We're seeing the same decline in deaths, though again, it's pretty much, if you look at the last year or so, the number has fluctuated pretty much around the same level. Almost 6 million deaths worldwide, and probably next week when we talk, we'll talk about the fact that there have been 6 million deaths by that point. In terms of the United States, we're seeing the same pattern. The Omicron surge is definitely coming down, or in fact almost gone. We're seeing hospitalization rates come back down, and we're seeing death rates coming down, but certainly not at the level that they have been in much of the previous times when things were slower and lower. We've had almost 1 million deaths, and probably in a month or so, we'll hit that point. Now, if we look at where the pandemic has been, you recall over the last 2.5 months, it went from not being very common to being everywhere to being not very common again. And this week, it's even lower than it was last week, though we're still seeing this cluster of high case numbers in Central Appalachia. And at some point in the future, we might talk about why that's happened. In terms of Tennessee, again, the Omicron spike has come down. Hospitalizations are coming down. Deaths were coming down. Then there's this weird little spike, which I think probably has more to do with how Tennessee reports deaths. There have been about 500 deaths in Tennessee in the last week alone, 24,550 deaths to date. In terms of our local region, we're down to 222 hospitalized patients, which, if you think about it, is still a pretty high number. And as you can see, this sort of sawtooth pattern back and forth. So the question that everybody keeps asking is the pandemic finally coming to an end? Well, if you look at worldwide, US, Tennessee, Ballad, what you can see is we are in a downturn, but there's nothing about the history of this pandemic that would suggest that it's in the process of going away. It may be, but no one can predict that. Really, what we've seen to date is this up and down pattern with some times that are much worse than others, sometimes that are slightly better. Let's be optimistic and hope that we're not going to see an upsurge, but I think at this point to say the pandemic is coming to an end is a tad optimistic. Now, the new mask guidance from the CDC has some people confused. They basically say when to wear a mask. If you're in an area with a high community level of COVID, you should wear a mask. Obviously, if you're sick or if you're around others at increased risk, you should wear a mask. The question is, how is community level calculated? Well, it's based on three things. How many admissions there have been in the past week? How many COVID admissions, the percent of staffed inpatient beds, how much of the hospital system is being occupied by COVID, and then the total number of new cases per 100,000 in the past 7 days. And so they come up with this list where you can see if you've had fewer than 200 cases per 100,000 or more, and then here are the indicators of number of admissions, staffed inpatient beds, and so on. And it's a nice pattern. But there's been, and by the way, if you want to find out what your county is, go Google COVID-19 by county CDC, and you'll get a page that looks somewhat like this. Then enter your state and county. Here I've entered Tennessee and Washington County, and press the Go button, and it will take you to a ranking. In our case, Washington County is considered high, which means the CDC still recommends that we wear masks when we're in public places. And they've even come up with a map, which is moderately helpful if it weren't a week out of date. Now, I did try to update it today, but for some reason, none of the CDC sites are opening, at least not to me. So what's wrong with this plan? I mean, it seems like it's pretty evidence-based, and in that sense it is, but there have been some criticisms of it. One is that it requires someone to check the website every day. Up until now, the guidance has been nationally do this, nationally don't do that. Now, in theory, you have to check it every day, and you have to decide, well, I'm in Washington County, but I'm traveling to Buncombe County, North Carolina, or so on and so forth. But there's a couple of other issues that I think are actually more important. One is that cases depend on testing, right? If we don't test anybody, we'll have 0 cases per 100,000. If we test everybody, we'll have a very high number of cases. So I've never been a fan of using cases for anything. The other issue is that while hospitalizations are a much better metric than cases, they are relatively uncommon and they lag a few days behind. So what that means is by the time we see increased number of hospitalizations, the virus is already widely spreading in that community. And in fact, it's made even worse because there's always a little bit of a delay between what we're seeing and what gets reported. So by the time we're seeing increased hospitalizations, it may well be that the cat's out of the bag, and it may be too late to really effectively wear masks. We'll wait and see. I suspect that most folks are pretty tired of COVID guidelines at this point, and we'll be lucky to get folks to wear masks until we see another spike. So how's the pandemic progressing? It's getting better, but there's no reason to predict that it won't come back up again at some point. And the new mask guidance is check the CDC website every day to decide whether your county is high, medium, or low risk. A great deal more information about COVID-19 on the College of Public Health website. If you are sharing this message with anyone, please let us know. We'd be happy to add them to our mailing list. As always, thanks to Dara Young for editing, producing, and posting this video. And as always, if you have any questions or would like any additional information, please let me know. A question did come in this week that I would like to address, and that's the value of wastewater testing. But as I mentioned, I can't access the CDC sites today, and I don't want to do it without getting the official government word on that. So hopefully I'll address that next week. Until next week, please be well.